All right, let's dive into something pretty fascinating today. Hyperbaric oxygen therapy. We're talking about a treatment for those really stubborn wounds that just refuse to heal. It's a world of pressure, pure oxygen, and honestly, some really cool science.
So picture this. You've got a wound, maybe a diabetic foot ulcer, and it's just stuck. Weeks turn into months and nothing seems to work. This is a massive problem that can lead to some really devastating outcomes, like amputation. But what if the answer wasn't some fancy new drug or dressing? What if the key was something as fundamental as air? Well, a special kind of air.
So what is this thing? Hyperbaric oxygen therapy, or HBOT for short. It's actually a pretty simple concept when you break it down. You lie down inside a special sealed chamber. In there, you're breathing 100% pure oxygen. And while you're doing that, the pressure inside the chamber gets cranked up to about 2, maybe 2.5 times what we're all feeling right now. A typical session, you're looking at about 90 minutes. Okay, before we go any further, we need to get one thing crystal clear. We are talking about systemic HBOT. That means your entire body is inside the pressurized chamber. This is totally different from something called topical oxygen, where someone might put a plastic bag or an oxygen boot over your leg. The science for that topical stuff is, well, it's pretty weak. In fact, most guidelines say don't use it. So for the rest of our time here, we're only focusing on the real deal, the full-body systemic therapy.
All right, so how on earth does putting someone in a pressurized tube full of oxygen actually help a wound heal? This is where the science gets really, really cool. Let's get into it. Here's a great way to think about it. Normally, oxygen travels around your body in your red blood cells. Think of the red blood cells as cars and your bloodstream as the highway. But in a nasty chronic wound, that highway can get totally gridlocked with swelling and damage. The cars just can't get through. What HBOT does is, with all that pressure, it literally dissolves a huge amount of oxygen directly into the plasma. That's the liquid part of your blood. It's like flooding the highway itself with fuel, so it can get to all those places the cars are blocked from reaching. And the effect of that is just huge. First off, it fixes the main problem, hypoxia, which is just the fancy word for tissues that are starving for oxygen. That's the root cause of so many chronic wounds. Once you get that flood of oxygen in there, the body's little construction workers, these cells called fibroblasts, suddenly have all the energy they need. They can finally get back to work, making collagen, and actually rebuilding the tissue. And it doesn't even stop there. This cycle of flooding the body with high oxygen and then returning to normal actually signals the body to build brand new blood vessels. It's a process called angiogenesis. It's like building new roads to get around the traffic jam for good. Plus, there's this really clever side effect. The high pressure makes your blood vessels constrict just a little bit, which helps squeeze out all that extra fluid and reduce swelling. It's a win-win.
And one last thing, it's a huge one. It helps fight infection. All that oxygen basically supercharges your white blood cells, turning them into more efficient infection-fighting machines. And what's more, a lot of the worst bacteria that love to live in deep, nasty wounds, they're anaerobic. That means they absolutely hate oxygen. It's literally toxic to them. So, you see, HBOT isn't just a one-trick pony. It's attacking the problem from all these different angles at once. Okay, the science sounds incredible, right? But here's the million-dollar question. Does it actually work on real people? Let's put the evidence on trial and really dig into the most studied area for this therapy, diabetic foot ulcers. The hunt for solid proof has been a really long road. If you look back to the 90s, you see these small early studies that looked pretty promising. Then jump forward to 2015, a huge Cochrane review comes out and says, yeah, there seems to be a short-term benefit, but honestly, the quality of these studies isn't great. But now, in just the last few years, new, bigger analyses where they lump all the studies together are starting to show a much clearer picture. They're confirming that, yeah, HBOT really does seem to help with healing, and crucially, with reducing amputations. But the debate is definitely not settled.
So when scientists take all the data from these different trials and pool it together, a really clear pattern starts to pop out. If you take standard care and you add HBO to it, the chances of the wound healing completely go way up. And the same thing happens when you look at major amputations. The rate goes down. And for a patient, that's not just a statistic. That is absolutely life-changing.
But, and this is a big but, here's the other side of the coin. You have groups, like this big German health agency, who look at the same data and say, hold on a second. Yes, the results look good, but a lot of these studies are flawed. They point to things like having too few patients or different studies doing things in different ways, and that makes it really hard to be 100% sure.
This right here is the central conflict in the world of HBOT, a really strong signal that it works, but nagging questions about just how good the proof really is. So where does all this leave us? Well, the general consensus right now is this. For a very specific kind of patient, we're talking someone with a severe diabetic ulcer that also has really bad blood flow, the term is ischemic, HBOT probably helps. The evidence isn't what you'd call a slam dunk, it's more like moderate certainty. But there is for sure a signal there that it's doing something positive. Okay, so with that moderate evidence in mind, how do doctors on the ground actually decide who gets this treatment? Let's take a look at what the official guidelines say. So we've got two of the biggest players in the wound care world here. First, there's the big international group, the IWGD. They give it what they call a weak recommendation. They say you can consider it, but only for those ischemic ulcers, the ones with bad circulation, and only after everything else has failed. Then you have the UHMS, the main hyperbaric society in the US. They're a little more assertive. They recommend it for more severe, deep ulcers, a Wagner grade 3 or higher that haven't gotten better after at least 30 days of the best possible standard care. But here is the single most important thing to understand about how this is used in practice. HBOT is never step 1. It's not even step 2. First, you have to do everything else right. That means maximizing blood flow, cleaning out the wound, getting any infection under control, and, critically, keeping pressure off of it. It's only if, after all of that, the wound still isn't healing for, say, a month or more, that a team might say, okay, let's consider adding HBOT into the mix. It's an addition, not a replacement. Of course, like any medical treatment, it's not all upside. There are risks. So we've got to talk about that, weighing the rewards against the potential problems. And there is one thing that is an absolute 100% non-negotiable deal breaker. You cannot go into a hyperbaric chamber if you have an untreated collapsed lung, a pneumothorax. It's just not safe. The pressure changes in the chamber could literally be fatal. This is the first and most important safety check every single time. Okay, besides that absolute no, there's a whole list of things that make doctors pause and be extra careful. We're talking about people with severe lung conditions, anyone with a history of taking certain chemo drugs like bleomycin, or someone with an uncontrolled seizure disorder. And then there's the practical stuff, right? If you're severely claustrophobic, a small chamber might be a real issue. And think about this. If you have a hard time popping your ears on an airplane, you're probably going to have a tough time with the pressure changes here, and that can mean some serious ear pain. So just how common are these problems, really? Well, the good news is, in a properly run facility, the therapy is very safe. For most people, maybe 75% of patients, there are no complications at all. The number one issue, by a long shot, is trouble with the ears, that middle ear barotrauma. It affects maybe 20–25% of people. But the really serious stuff, like a seizure from the oxygen, that is incredibly rare. We're talking less than 1%. All right, so we've covered a lot of ground. We've looked at the science, the debate over the evidence, the clinical guidelines, and the risks. Let's tie it all up and get to a final verdict. So if you're going to remember 3 things from all this, make it these. Number 1, this is a targeted tool, not some magic bullet. It's meant for a very specific type of severe, stubborn wound. Number 2, it's an adjunct therapy. That means it's an add-on to great wound care, not a substitute for it. And number 3, the evidence, while really promising, isn't perfect. It strongly points to HBOT helping heal wounds and prevent amputations, but pretty much everyone agrees we still need more high-quality research. And that leaves us with one final question to chew on. Is hyperbaric oxygen therapy a powerful, high-tech tool that's finally on the verge of mainstream acceptance? Or is it a really promising idea that's still just one big blockbuster study away from proving its case once and for all? You know, the truth, as it so often is probably somewhere right in the middle.